So it has been 190 days since President Trump took office, and people were promised a bunch of stuff in that election. They were promised it in Colorado, they were promised it in Texas, and they were promised it in North Carolina. North Carolina's on my mind today. There's a few things going on there. Higher costs is what we've gotten instead. Higher costs from the health care to people's housing to grocery stores. I was up in Grand Marais, Minnesota, and saw someone walk out of a grocery store, just happened to be walking in, saw her look at her receipt, she's looking down, and she's just, no. That's how people are feeling. They're looking down at those going, no, I can't afford this. He's given us more chaos, from Social Security and the VA to the Weather Service and FEMA. I'm going to an ag hearing tomorrow that I called for oversight, and I'm glad Senator Bozeman is doing this, where they've decided to split the USDA into 5 hubs, including Utah, which means they will be incredibly less effective than they are doing their research and being able to work like other agencies do. We have seen new levels of corruption, whether it is the billionaire tax credits or what Senator Schumer just spoke to, which is the Epstein scandal. Americans know the president is not delivering what he has promised. So one of the things as we go into August that people should think about is that it's not just all far off. It's happening right now. It's happening in November when 20 million Americans signed up for health insurance will see higher premiums, $700 more on average across the country. In Minnesota, Michigan, and Maine, we're going to see premium increases up by 15% for the Affordable Care Act plans. In Texas, Georgia, and Vermont, they may surge by more than 20%. 7 million Americans are expected to lose their health care. Rural hospitals. I went on a tour of those over the weekend, and I can tell you they are hanging on already by a string. They've got to deal not only with the Medicaid cuts I just talked about, they've got to deal with the Medicare because of the huge trillions of dollars in debt, $4 trillion this bill added. It triggered automatic Medicare cuts of $500 billion, a lot of them landing on hospitals, and particularly rural hospitals. 300 expected to close. The other thing that's happening right now, tariffs. We all know that. August 1st, the big, beautiful deadline. And as Chuck mentioned, this president has changed these tariffs over 100 times in just these last 190 days. They are already facing higher costs. It's a tax on families, and imagine bragging about imposing a $100 billion tax on Americans. So whether it's the women I saw coming out of the grocery store, or it's the people who are calling in Social Security benefits in Washington State, can't get anyone to answer their call. Guy who just lost his wife in my state, finally had to drive in, couldn't get anyone to talk to, finally had to call our office, finally had to drive hundreds of miles to try to get help. Americans are paying the price for this health care sabotage, and sadly our Republican colleagues have done nothing but rubber stamp.